I am Dr. Nisarga, Professor of Pediatrics. Today's topic for discussion is short stature. Short stature is a very important topic for discussion for the reason when a normal height is not attained by any individual, there will be a low esteem in a normal person. And there are pathological conditions due to various diseases resulting in short stature. If those pathological diseases are identified early and appropriate intervention is done or made, then we can ensure a normal height in those individuals also. Here the important factor is we have to identify the operating factor to make the person short and treat it so that we can make the person to attain his full potential of height. The growth monitoring should start from birth. At birth, you have to look at weight, length, and head circumference. And these three parameters are assessed serially when the child comes for immunization up to 2 years. And from 2 to 8 years, the child is assessed every 6th month, every 6 months. Here, height and weight is taken into account. And you calculate the BMI, body mass index, and record SMR staging in a child beyond 6 years annually. I hope you know that SMR, sex maturity rate. What I mean to say, when a person is child, he doesn't have any sex maturity features. But around 10 years of age, the adolescence starts. There, the sex maturity features start appearing. From 9 years to 18 years, the height and weight assessment is made every year. And in addition to that, BMI and sex maturity rating has to be observed. Growth can also be assessed at times the child is brought for any other reason to the physician. Coming to the significance of the growth monitoring. What are the significance monitoring this? It detects abnormalities, if any, in the growth, and it also monitors nutritional status, and also it monitors once we start the intervention how much the response is achieved. How to measure? In a small infant that is below 1 year, it is usually in the weighing scale, preferably electronic weighing scale, and see that there is minimal cloth or no cloth, and ensure that before start weighing 0. Then coming to the height, we use the word length when you measure horizontal distance, and the height when the vertical height is measured. After 3 years, height is recorded in the vertical position. Make the child to stand straight against stadiometer. Stadiometer is the instrument to measure the height. And he should stand straight with occiput, shoulders, buttocks and heels touching the vertical bar behind. And he should look straight. Then horizontal bar is lowered to the vertex of the child and take the reading. And in the diagram it is shown very clearly. You just learn from the diagram how to measure correctly. Once again repeat, the instrument used to measure the height is called stadiometer. But below 3 years, because they don't cooperate, we cannot take the vertical height. We have to make the child lie down and the horizontal measurement has to be made. And this instrument is called infantometer. There is a headboard and there is a footboard. You can see that, on two ends, one on each end there is one board, headboard and a footboard. And make the child lie down straight with the knees straight and measure the distance between these two boards. That gives you the horizontal measurement of the child below 3 years of age. The head circumference is measured between the prominent points in front and the back of the head. In the front, the prominent points are the superior orbital ridge, and at the back, in the occipital region, it is the maximum protuberance present over the occipital bone. Between these two, the measurement is made. But at birth, should not do a head circumference within 24 hours. It should be measured only after 24 hours for the reason there is caput succedanum edema in the presenting part. That will give you a false reading. Then, coming to the arm span measurement, make the child to stand straight against the wall and stretch the upper limbs and mark the tip of the middle finger on either side and take the measurement. That gives the span measurement. So we have a height chart, the developmental chart, that is growth charts, and whatever the measurements we take or measure, that is a height and weight and head circumference, you plot on a growth chart. Here is an example. A 6-year-old boy having a height of 102 centimeter. How to enter this on the growth chart? Draw an imaginary line along the x-axis, that is a horizontal. You can see the horizontal red line till the age of the child is reached. Here the child, a 6-year-old child, that means from here, in the beginning up to 6, you can see here. So roughly that is up to 6, you draw a horizontal line. Then age we have identified in the chart. Then what you have to do is draw an imaginary line along the y-axis. That means you have to extend this line upwards, that is the vertical line, that is called y-axis, up to 102. You can see here 102. I hope you have marked the point. Then coming to the next slide, the weight. The same 6-year-old boy has got a weight of 22 kg. So you are drawing the a line on the x-axis, that is horizontally, till you reach the age of 6, because child's age is 6. Then you extend this line on a y-axis, that is vertically up, till you get 22 kg. So you have seen here 22 kg. See here 22 kg. The upper dot is height and the lower dot is weight. You have learned how to plot this on the chart. Now we'll go to the next slide. The height of 102 centimeter, weight of 22 kg have been entered. Now we know, though the child is 6-year-old, what is the height, whether he has got appropriate height for his 6 years, appropriate weight for his age 6 years, or less or more. Let us see now. Here what you have to do is, the ideal height or weight or whatever the measurement is at 50th percentile. See, 50th percentile is supposed to be normal. See, this is the 50th percentile. Come lower down. It is less than 50th percentile. Then what you have to do is, it is here, this dot is less than 50th percentile, very much low. You draw that line to touch 50th percentile. Somewhere here it is touching the 50th percentile, and once it touches the 50th percentile, you draw down and see where it ends. So this is ending at 4. That means the height of the child corresponds to the 4 years. Though chronologically the child has 6 years, his height corresponds to 4th year. Height age, we call it as height age, is 4th year. Is chronologically 6 years. In the same way, look at the weight. Weight is more than 75th percentile here. You bring that to the 50th percentile. Then you draw that line down. It is touching 8th year. So, chronological age of the child is 6 years. His weight corresponds to 8 years. That means he is short and having more weight. Height corresponds to 4th year and weight corresponds to 8th year. I hope you have understood. Then we'll now move on to mean parental height. What do you mean mean parental height? Mean parental height means you take the average of the mother height and the father height and divided by 2. It is called mean parental height. Here, for boys, how much they attain the final height is calculated taking this average of the height of the mother, height of the father, and if the child is male, you add 30. What I mean to say, mother height, father height plus 13 divided by 2. That gives you mean parental height. That means this is the height the child is going to attain, this male child. In the same way, for a female child, it is calculated mother height, father's height minus 30 divided by 2. And mean parental height, and in that, whatever we calculate the final height, either 6 centimeter more or less, they attain. And this is called target range. In the calculated height, either they can have 6 centimeter more height or 6 centimeter less height. This is called target range, 6 centimeter. So height of the boy 103, it is mentioned 102, and the father's height. So here is an example. Height of the boy is 103, father's height is 160, mother's height is 147. You calculate now. Father height, mother height plus 13 because it's a boy. And if you calculate that, the mean parental height is 160 centimeter. The target range in that, 160, he may attain 166 or 154 because 6 centimeter may be more or 6 centimeter will be less in the final height when he is going to attain. This is called, that is how you can calculate. Plot the mean parental height and the target range on the growth chart. Here, this is an important chart. Look at here. So, this is 103, the height, the red spot on the top. And extend an imaginary line backwards. That means the target range is the extended centimeter, that is 160. So here it is calculated 160. Look at here, 160, the middle arrow 160. So either he attains 6 centimeter more or 6 centimeter less from 160. And here what you have to do is extend an imaginary line backwards from the lower end of the target range till it reaches the patient height. The lower end of the range and the dotted line coming down to touch the patient height. If a short child's height is above this line, then child is familial star stature. That means their final height is also less, and in the family it is like familial. That means the height is like his parents, familial. And if below, then child is pathological short stature. That is, if the uh, child's height falls below this line, then there is a this is pathological short stature. Familial means like his family members, so he is going to attain the height. If they are short, he is also short. If they are tall, so final height will be reasonably a good height. That's how it is calculated. Then height velocity. In this slide, I cannot show clearly, but the height velocity is measured. For example, here it is given how much the way the height is gained in a year. For example, here there is one example is given. 9 years old child. At 9 years, his height was 190, and at 9.5 years, it is 122. That means he has gained 3 centimeters of height. In a year, 6 centimeters. And that falls between 75 to 90th percentile. Any growth velocity lesser than 25th percentile, it is abnormal. It is abnormal. How to measure the body proportions? You take in the stadiometer from vertex to feet, final height you take. And in that, we can calculate upper segment and lower segment ratio. Measure lower segment from top of the symphysis pubis to floor. 2 lines are given. The symphysis line is there. Subtract the lower segment from height to get the upper segment. It is this ratio is calculated to identify whether is proportionate dwarf or disproportionate dwarf, or short-limbed dwarf or short-trunked dwarf. Short limbs. Here the increased upper segment, and in short trunk the decreased upper segment compared to the lower segment. The examples are in short-limbed short stature, achondroplasia, hypochondroplasia, chondrodysplasia, mesomelic dysplasia, acrodyastosis. In decreased, that is short tongue, spondyloepiphyseal dysplasia, spondylometaphyseal dysplasia, mucopolysaccharide deficiency, and mucolipidosis. Skeletal survey should be done to rule out skeletal dysplasia in patients with disproportionate short stature. This is a sex maturity rating, that is Tanner's sexual maturity rating. When a child reaches the adolescent age around 10 years, in girls 1 year or 2 years early, there are 5 stages. I don't go in detail here for the reason that it takes the whole class one day. There are 5 stages in both boys and girls, and these sexual maturity rating corresponds very clearly with the height age, the bone age. Bone age. See, look at here. The bone age is estimated by taking an X-ray of the non-dominant hand anterior-posterior view. That means non-dominant means in a right-hander it's the left hand, in the left-hander is the right hand, and compared with the standard of the same sex and nearest age. It is next compared with the adjacent standard, both older and younger, to get the closest match. What does the bone age tell? Skeletal maturity and correlates closely with the SMR. I have already told you the bone age corresponds to the sexual maturity rate. Speaks for remaining growth potential. How much growth is left once you take the once you come to know that what is the bone age, and its sexual age is also same, and how much potential is left you can calculate, and helps in adult height prediction. Bone age delay of more than 2 standard deviation, that is about 2 years, is significant. Delayed in most cases of short stature, except few conditions like familial short stature. Most causes of short stature except few conditions like familial short stature. Coming to the definition of short stature, height less than third percentile of the norm for age, or more than 2 standards below the mean height for that age, sex and reference population. Height velocity less than 25th percentile for age, sex and reference population. If the velocity is less than 25th percentile, or if the height is less than third percentile, or it is more than 2 standard deviation below the mean height. This is definition is clearly remember. If you cannot remember, you buy it. Causes of short stature. And there is a mnemonic, is nice. ISNICE. I means idiopathic, S means skeletal causes, nutritional, iatrogenic, chronic diseases, and endocrinal causes. Familial short stature. Here, in the family, their height is less, and right from the beginning in the child also you note down the height on the lower side, and as he grows, he maintains the height at a lower percentile all along, and final height is also less like his family members or his parents. That is called familial short stature. Here the mean parental height is less than third percentile. Parent's height itself is less than third percentile, and he will have that all along the growth from child to an adult at a lower, less than third percentile only. And he will attain the sexual maturity at appropriate age. Normal height velocity. Velocity is also normal, more than 25th percentile. But the final height is less, initial height is also less. Normal, the weight gain, that is normal height gain, the height gain every year is normal, but at the lower side. There is an formula here to describe familial short stature. CA means chronological age is equal to bone age here. His age corresponds very correctly with the bone age, which is more than the height age. That means his height is less compared to his age and compared to his age. In other words, his age is more than the height is more his age is, for his age, the height is less. This height age corresponds to bone age. Final height is less than third percentile for reference population, but within the target range. Constitutional delay in growth and puberty, it is called CDGP. Here, the mean parental height is normal, but as a child, his height is less. But finally, he will attain the height what is expected as his potential. Like his parents are reasonably normal or normal, but this child in the beginning, in his childhood days, looks or apparently looks like he is short. But when you plot this, the mid parental age, that's a mean parental height, and when you range, when you draw the line, you can make out his